A very good evening to all of you. Myself, Dr. Jamuna, heading Clinical Excellence and Research Team at QurHealth. I welcome you all for today's webinar session on male infertility, what couples need to know. Our guest speaker for today is Dr. Upendra Kumar. He is a famous senior urologist, andrologist, and transplant surgeon in Secunderabad. Firstly, let me brief you all about our company, QurHealth. We are a conversational AI company delivering personalized care at scale. Our vision is to save lives super proactively. Our user-friendly app, Qurbook, has more than 2,500 care plans and diet plans under 30 different health specializations. These plans help to improve patients' health condition by monitoring vitals, symptoms, and everyday lifestyle management activities which are specific to disease condition via AI Sheila in Qurbook app. Our Care Concierge program consists of expert care team with specialist doctors, dietitians, physiotherapists, fitness coach, counselors, and highly skilled care coordinators who are trained and expert nurses. These care coordinators will be remotely monitoring your health condition through regular follow-up calls, and they make sure that you adhere to your care plan activities, you take medication on time, and eat healthy food that is being listed in your diet plan. So today, let's begin our webinar session. I would like to introduce first to our speaker for today, Dr. Upendra Kumar. Dr. Upendra Kumar is a renowned urologist with more than 20 years of experience, and he is currently practicing at Krishna Institute of Medical Sciences, KIMS, Secunderabad. He did his MBBS from NTR University of Health Sciences, Andhra Pradesh, MS in General Surgery from PGI MER, Chandigarh, and MCH Urology from NIMS, Hyderabad. He was consultant urologist at Apollo Hospital, Kakinada, consultant urologist and HOD at Image Hospital, Hyderabad, as well as consultant andrologist at Dr. Ramaya's Urology Nephrology Services at Pramila Hospital, and senior consultant urologist and andrologist, as well as transplant surgeon at Apollo Reach and Aware Global Hospitals, Karimnagar. Dr. Upendra Kumar also provides consultations to patients at his own clinic named Sri Yashaswini Datta's Kidney and Urology Super Speciality Clinic. He is a reputed doctor and gives his patients his undivided attention. Dr. Upendra Kumar is a renowned member of the Indian Medical Association, South Zone, Urological Society of India, and the Indian Association of Sexology. He has been rewarded with various awards, including Vaidya Shiromani in Urology and South Zone Urological Society of India. Welcome, Dr. Upendra Kumar. We are very honored to have you with us today as our speaker. We also have our expert dietitian, Sutapa, with us today, who will be highlighting on significance of diet on male infertility issues. Sutapa holds more than a decade of experience in diet and nutrition field. She has exclusively designed more than 500 diet plans in Qurbook app under different health specializations. On daily basis, Sutapa provides diet consultations to patients and customizes diet plans as per health conditions of the patients. Welcome, Sutapa, for today's session. I would like to inform all the viewers that you can type your question in the comment section, and these questions will be answered at the end of the webinar during Q&A session, which will be conducted by our marketing and communications leader, Dr. Isha. So let's begin our webinar session on male infertility. Infertility is a global issue affecting millions of people of reproductive
Are you able to see me?
Yeah. According to World Health Organization, infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility may occur due to various factors. It can be due to male factors, female factors, or a combination of both male and female factors, or sometimes unexplained. Research showed that infertility affects 8 to 12% of couples globally, with male factor being a primary or contributing cause in approximately 50% of the couples. Male infertility is one of the leading causes of infertility and yet is frequently under investigation. Many people believe the common myth that infertility is just a woman's problem, which is far from the truth. Infertility needs to be addressed as the inability to have children, which affects the couples and causes emotional as well as psychological distress in both men and women. This webinar aims to highlight the concept of male infertility and discuss the cause, diagnosis, and treatment of male infertility issues. So, Dr. Upendra Kumar, please let our audience know the potential causes of infertility in men and what signs and symptoms that are noticed which men have infertility.
Yeah. Good afternoon, everyone. Yeah, am I audible?
Yes, doctor, but your video is like tilted.
Tilted, okay, 1 second. Is it okay now?
Yes, yes.
Yeah. Actually, the male infertility is one of the commonest problems we see, and it constitutes around 50%. And if you see, there are various causes starting from childbirth, like they are called congenital, till the elderly, like. So the various, that is one area. And second one is genetical and non-genetical. Some are, they run in families, some are genetically mediated, like the chromosome or gene is responsible for this male infertility. So let us come from the childhood diseases, which are congenital. So in congenital, the main common condition is undescended testis. So where normally the testis descend from the kidney area into the scrotum, this doesn't happen in many people. So that is one of the commonest infertility cause in childhood. And other problem is testicular torsion. Because of these undescended testes, their abnormal position will prone the testis to rotate on itself. It's called torsion testis. And that leads to damage to the testis many a times. So that is another reason. And apart from that, some genetical conditions like Klinefelter syndrome, where the chromosomal abnormality is there, where there is an extra chromosome called XXY. So that is another reason why patient can have this infertility. And actually nowadays, because of increasing IVF centers, so any patients who have undergone IVF in the future, the children born to them also are prone to get this type of male infertility for their kids, like for their progeny. So these are some of the congenital conditions. Apart from this, there is another common condition called cystic fibrosis. This also is a genetically inherited condition where the movement of the sperm is inhibited and there is absent seminal tracts called vas deferens. So that is another reason why patient can have male infertility. So these are the childhood causes. Apart from that, when you come to an younger age, children have there are various conditions. It's called ejaculatory duct obstruction. This is also because of the congenital condition, but it will manifest subsequently because it doesn't cause any other symptoms except that there's no sperm when the patient is already married and trying for kids. So this is called ejaculatory duct obstruction. It can be due to various reasons. So because of the developmental abnormalities, the patient has absent sperms. And the other reasons we usually see are infections in the younger age group. They can be normal urinary tract infections due to various reasons like secondary diabetes, because nowadays you are seeing too much of diabetic patients due to overweight. So that is another reason why infections can lead to infertility. These infections can be sexually transmitted and non-sexually transmitted. The sexually transmitted infections cause more damage to the seminal tract. That can lead to blockage of the tracts, and that leads to the infertility issue. That means there is a sperm quality reduction, sperm count reduction, there is a blockage of the tracts. All these things happen with sexually transmitted disease. Apart from this, the pulmonary causes. Nowadays, tuberculosis is very common, rampant in India because the smoking habits have increased. So that itself can lead to damage to whole testis tract called epididymis, vas, or it can even fibrose the ejaculatory duct. So this can lead to, again, infertility, sometimes completely absent sperm. And other reasons, like we see nowadays, is excess use of mobile phones also, because radiation is one of the most dangerous thing for infertility. So excess use of any person working in either in the radiation department like X-rays and other things, or else anybody using excess of phone, and this mobile phone, if it is kept close to the scrotum, that usually the radiation which is there, that can also cause in long term the semen abnormalities. Apart from this, various lifestyle habits, like nowadays there's a lot of smoking, a lot of alcoholism. So smoking itself can damage the sperms, and it can cause a lot of reduced testicular size and other things. So these are one of the lifestyle changes which can cause. Apart from that, obesity is one of the commonest things, because nowadays almost 1 in 4 patients are obese. So obesity is itself again a cause for male infertility, because obesity causes a lot of changes in the body. It reduces the testicular sperm, it reduces the hormonal changes that also can lead to infertility. Apart from this, there is a surgically treatable conditions also, like varicocele. Varicocele is a condition where there is a lot of the venous complexes around the testis, which form a worm-like shape. So there is a stagnation of blood, and that leads to male infertility, because that affects the sperm temperature, the temperature of the testis, which causes excess temperature, causes sperm defect, motility, etc. count. So that is one of the surgically treatable condition which we have. Apart from that, which I was telling you, the other one is ejaculatory duct obstruction, which is again by birth congenital. So these are some of the reasons. And apart from this, the persons working, occupational exposure is very, very important, because the workers working in the chemical industries or the agriculturists, because these agricultural people are more exposed to the pesticides, herbicides, and a lot of people now, women, they or male, anybody, they are using more of cosmetics. This cosmetics also will lead to a problem. Apart from this, the chemicals which I was telling, they are absorbed in the air or in the soil, and that we are daily ingesting. And slowly there is a slow poisoning like thing, and it is affecting the sperms. So apart from this, lot of people have some surgeries done to various reasons. It can be related to hernia surgeries, some abdominal surgeries for any tumors. Sometimes some children, they do suffer from testicular cancer, for which testis is removed. And apart from that, for these cancers, usually chemotherapy or radiation therapy is given. That itself can again cause problem to the males, because it affects the testis and sperm quality. So that can lead to, again, male infertility. Apart from this, some people have erectile dysfunction, which itself can be a cause, because without the erection, there is no ejaculation. So without the, because of these sexual desire problems or sexual problems, patients become infertile. Apart from this, there can be ejaculatory disturbance. That means semen doesn't come out. That is called ejaculation. It can go back into the bladder. That's called retrograde ejaculation. Sometimes there is no sperm at all coming out. That can be because of some neurogenic causes. Patients having some spinal injury that leads to the neurological defect, and sperm doesn't come out. So these are some of the conditions. Apart from that, sometimes other tumors which are in the brain, like pituitary tumors, hypothalamic tumors. So these are also some of the causes which can lead to reduced hormonal changes, and that can lead to infertility. Apart from that, some people by birth can have hypogonadism. That means the male hormones are very less, like in a condition called Calvan syndrome, etc., where actually the hormones are so less, testosterone is less, and all our sperm is dependent upon these testosterone levels. So that itself can be one of the other cause of the defect. And apart from that, certain people have genetical reasons, like they can have chromosomal abnormalities, they can have gene mutations which can lead to problems. And as I was telling you, cystic fibrosis gene is very common where the patient is infertile. And nowadays, a lot of medications have been used. So for people who are using anabolic steroids, like in gyms and other people, they keep giving to develop their body. Apart from that, long-term usage of steroids, that also can lead to infertility. And some of the alpha blockers, that means they are used for urinary symptoms like BPH or functional bladder obstruction or prostatitis, though they also can lead to retrograde ejaculation, and that leads to male infertility. And as I said, lifestyle changes, either obesity or sometimes smoking, alcohol, they also cause a lot of problems. And some people, they may have a child, and for a second conception, they may undergo suddenly vasectomy, and they don't want a child first initially, but they want again. So these type of mistakes also can cause male infertility, as that is called secondary infertility. And as I said, prior surgeries are very, very important, because surgeries around the testis or in the scrotum or hernial surgeries can affect infertility. So all these things have to be kept in mind before we plan for any further evaluation. Thank you.
Okay. So, doctor, you explained all the causes of infertility in men. Now, I would also like to ask you about the primary signs and symptoms which men need to take care of, which is the indication of infertility in them.
Yeah, basically the signs and symptoms are, as you know, any patient who doesn't develop secondary sexual characters. That means beard, the mustache, and then the hair distribution all over the body. And some people can have enlarged breasts, that's called gynecomastia. These all suggest some problem with the hormonal issues, like testosterone may be low, or he may be having some other conditions where he can have a hormonal issue, which indirectly is affecting the testis. Second thing is hypothyroidism. Any thyroid issues also indirectly affects the thing. So for hypothyroidism, the signs and symptoms are that thyroid levels will be low on examination, and the patient will be obese, and he will have a lot of he has hypertension and overweight. That means patient will be and fatigued. Some of the signs which you observe in these patients with reduced temperature also. Sometimes they have hypothermia. That is very important in thyroid patients. Apart from this, if you examine, some patients may not have a testis in the scrotum. That is called undescended testis. It can be missed in childhood. So examination is also very, very important. Apart from that, in the external genitalia, some patients can have hypospadias. That means the urine tract, urethra we call it, it is not completely formed. So the urethra will be backside, and the sperm, when it comes out of the urethra, that doesn't go into the vagina, it falls down. So that is one condition where patients can have infertility. So on examination, these are the signs which we do see. Apart from that, and sometimes there can be a testicular mass-like lesions. That is, younger age groups, usually we see testicular cancer. So that is one thing which we need to exclude. Apart from that, patients can have infections. That's why there can be a swelling, redness, pus coming from the testis. So these are some of the things which suggest there is an infection. Apart from that, if there is a sexually transmitted disease, you can see some discharge coming from the penis. Sometimes there can be an infection of the prepuce. That's called belanoposthitis. Many of the diabetics, they do have sugars coming through the urine. So that leads to fungal infections, secondary bacterial infections. And there can be an infection of the prepuce. Sometimes prepuce can be closed. That is called phimosis. And some people can have a narrow urine meatus. That means the opening of the urine tube. So that also can lead to infection and reduced semen quality. Apart from this, some people can have prostate infection. So when we examine, there can be a tender prostate. So that is one of the reasons they can have infertility. And The other symptoms, sometimes we have, as I was telling you, congenital disease like cystic fibrosis gene, where they can have recurrent respiratory infections. Somebody will be getting every month or something like that infections. So when you go back and see, most of them, these people have immotile cilia syndrome. That's called cystic fibrosis. That can lead to infertility. So that's one of the things which you need to keep in mind. And as I said, gynecomastia has to be seen because in males you don't find breasts enlarged, but some, because of various reasons, it could be hypogonadism or any reason, patients can have the increased breast size. And some people can have inability to smell because some of the tumors in the brain, like pituitary tumors, they can cause this loss of smell. So this is one of the symptoms which we need to look into it. And on examination, sometimes you can see bag-like worms in the testis. That is called varicocele, which is very, very important sign for us. So that will give us an idea that, okay, varicocele is the cause for this infertility. Apart from that, we do a basic semen analysis. That is very important. That is one of the reasons why we come to know how the patient has infertility or not. So normally the semen analysis, the volume is quite good. It should be more than 1.5 to 2 ml. And the count should be at least more than 40 millions total and more than 15 millions per ml. So if there is any abnormality in the semen, either the count is reduced or the quantity is reduced or the qualities come down, like motility or viscosity, the vitality, etc. So that can give a cause for infertility. These are some of the signs which we need to see physically, and with semen analysis, we come to know exactly which part of the semen is defective.
Yeah. Okay, doctor. So over the last decade, ability to diagnose and treat infertility problems has greatly advanced. So which are the most advanced tests used to diagnose infertility in men, and how would doctors or specialists help or guide men diagnosed with infertility issues?
Yeah, actually nowadays we are seeing a lot of infertility. Though I didn't mention before, basically around 50% still we don't have a cause. That is called idiopathic. So the female and male factors may be normal, but still they may not be conceiving. So there are still 50% causes which we don't know. And coming to your question now, the basic test we should do first is the semen analysis, which is now computerized analyzed semen analysis, which will give us a lot of parameters, starting from the volume, then the liquefaction time, the counts, the motility pattern, the viability, and any presence of pustules, leukocytes. So these give an idea what is the cause going wrong with the patient. This is the basic test which we need to know. Semen analysis which gives us an idea whether the patient has zero sperm, that is called azoospermia, whether he has a low sperm, which is called oligospermia. This can be very severe, that is less than 5 million sperms. 5 to 10 is mild, and more than 15 is normal. So if somebody is having very low sperm counts, we need to detect some other causes. May not be alone normal routine lifestyle causes. It could be some genetic related causes also, or some hormone related causes. Apart from the base analysis, show some problem. Then based on this, we need to go for other tests. As I was telling you, we need to give us idea what type of varicocele it is. Usually the higher grade varicoceles, which is also called grade 3 varicoceles, they cause a lot of problem, and they can even lead to, because these varicoceles causes increased temperature that leads to reduced sperm count and motility. Even the testis size can also go down. So total ultrasound is the next test which we do. Apart from that, as I was telling you, to rule out infection, we have to do all the STD profile as well as CUE, and in the semen we need to look for any leukocytes, which gives us an idea that okay, this patient has an infection. Apart from that, if you are suspecting Koch's disease, which we need to do a PCR for Mycobacterium tuberculosis, which will give us an idea. Apart from that, we need to do a hormonal profile. If the counts are very low, like less than 5 million sperms, we need to do all the tests like serum folliculating stimulating hormone. That's also called FSH. We need to do luteinizing hormone, LH. Then we do a prolactin hormone, then thyroid stimulating hormone. And sometimes we even do the estradiol levels to know the status of estrogen. So all this gives an idea, is there any hormone related issues. So all these tests have to be done. Apart from that, we do anti-sperm antibodies. Some of the patients do have antibodies against their own sperm. So these are also one of the cause for the infertility. So anti-sperm antibody assays are very, very important from the semen as well as the blood. Semen is more accurate rather than the blood levels. Apart from that, where we are suspecting genetical diseases, we need to do karyotyping as well as gene mutation therapies, gene mutation tests, which will tell us what is going wrong with that. And in this, we have a lot of PCR tests and etc. Apart from that, we need to do, suppose we are suspecting ejaculatory duct obstruction with surgically treatable condition, we need to do a transrectal ultrasound, which will give us the status of the seminal tract, the seminal vesicles, and the ejaculatory ducts. So this is also a very important test which we need to do. Apart from that, which is very, very important because this normal levels are up to 31%. If it is more than that, because of the defective DNA, patient may not conceive. Even if you go for the IVF or ICSI also, assisted reproductive techniques, that can be, may fail. So it's always important to know the DNA status of the sperm. So then only we can proceed with the treatment aspect. And another important thing is the oxidative stress, because we see a lot of this oxidative stress nowadays due to various species which can lead to the reactive oxygen species. So they cause a lot of damage to the sperm and sperm DNA. So we have to estimate that by doing an oxidative or reductive study test, which will tell us how much is the extent of this oxidative stress. That also is equally important for us nowadays. That we will come across next when we are discussing the antioxidant therapies. So these are some of the things. And in those patients who are having azoospermia, we have to exclude retrograde ejaculation. So we need to do a post-ejaculatory urine analysis, which can give us if the sperm is going back into the bladder and into the urine, it is coming out. Apart from that, in azoospermia, if the FSH levels are normal, we have to go for a testicular biopsy. There are various types of biopsies we do. It could be epididymal aspiration, it can be testicular biopsy. So these are some of the tests which confirms whether there is any testicular production of the sperm. If at all it is there any maturation arrest in those things? So all these things are very, very important when we are doing these tests. So these are the advanced tests which are being done if there is a defect in the sperm analysis or there is zero sperm. That's called azoospermia. Thank you.
Okay, thank you, doctor. Like you rightly said that stress, oxidative stress definitely affects infertility. Various studies have shown that stress is associated with reduced paternity and abnormal semen parameters. So how does psychological stress affect male fertility? Can stress permanently damage fertility?
Yeah, this is very important because as you know, every one of us are stressed in nowadays. So including I see more of IT people getting more stressed because they keep on sitting in that and keep on looking at the laptops. So the stress is very, very important aspect because whenever there is a stress, leave alone anybody having stress, the glucocorticoids, because the adrenaline is stimulated in that. And so there are excess steroids coming out into the blood, rotating. They are called glucocorticoids. So these cause indirect effect on the brain, like hypothalamus we call, that reduces the luteinizing hormone and testosterone levels, which can lead to infertility as well as impotence. Like they can have less sexual desire, testosterone levels come down. So when there is a reduction in the testosterone levels and there is reduced the gonadotrophic hormones like LH, FSH, automatically the sperm quantity goes down because it is hormonal dependent. Intratesticular testosterone should be more. So any person having stress or depression will have enhanced corticosteroids, that's called steroids. So these cause these type of changes and they're not permanent because with counseling and other things, slowly the stress part can be brought out. They can have like some relaxation techniques, meditation, etc. nowadays. So once the couples start getting coming out of that stress, due to various methods now, like relaxation techniques, yoga, exercise, walking, reduction in weight. So generally they do improve, and it's not a permanent problem. So the stress male infertility.
Okay, doctor. And also, age is one of the most significant factors affecting couples' chance of conceiving and their pregnancy outcomes.
Yeah.
So, what are the main reasons for age-related decline in male fertility, and how to overcome this age-related infertility in men?
Yeah, basically nowadays you are seeing everybody is taking a lot of time to settle. So everybody is getting married at the age of 30, 35 also, which is not a right age. Ideal age ideally should be between 25 to 28 or so, for males particularly. So this is not happening nowadays. So with the increasing paternal age, definitely there are a lot of studies which have been done, which have shown that there is 50% reduction in the semen parameters beyond 40, 45 years. So any male getting married should be below 35 rather than going beyond that age, because that causes a lot of changes in the hormonal environment as well as the semen parameters. That leads to reduction in the sperm count by 50%, which is very, very significant. So the main factor is that anybody who is getting married should be married somewhere between 25 and between 30 below. That would be an ideal age for men. And beyond 30 to 45 years, there are a lot of congenital abnormalities which start coming, like Klinefelter syndrome, Down syndrome. So many are there which are recorded if somebody is marrying beyond 35 years. But males may not be 35, but at least beyond 40 and 45, there are a lot of congenital anomalies which can occur. Apart from that, infertility is one of the most important factors in elderly age. So ideal age would be that should get married between 25 to 30 years, which should be ideal. And beyond that, you do expect a lot of chromosomal abnormalities, DNA fragmentation, hormonal changes. So all these can lead to a reduced infertility. And the studies themselves show every decade increasing, there is a 50% reduction in the sperm quality and quantity. So that is one of the reasons for increased paternal age.
Okay, doctor. So many also have this misconception of infertility and impotency being one and the same. So doctor, can you please explain the difference between these two conditions?
Yeah. As we all know, infertility, that means fertility. Fertility means bearing a child. So to get a child, we need a sperm ejaculate, and then we have, suppose the sperm quality or the quantity is less, you may not have kids. So this is called infertility. But impotency is something completely different. Impotency is a reduced sexual desire or inability to perform intercourse. So impotence has no role with the infertility. But if the person has an impotence, yes, he will not be able to have ejaculate. If there is no ejaculation, automatically that can lead to infertility. So impotency can lead to infertility, but infertility persons need not be impotent. That is a very important thing. So any reduction in sexual desire or inability to perform sex after marriage is the cause for impotence. It has no relation to infertility, but any person having impotence, he will not have normal intercourse. So definitely, so there is a problem with the ejaculation part. So any person not doing it is called unconsummated marriage, which is very, very important for us. And that can lead to infertility. So all this having the doubt of infertility and the impotence is completely different issue. And impotence can lead to infertility, but impotence has no role. I mean, it is something different. It is only a sexual disorder. But infertility is a problem with the bearing of children. That is a kid's problem. So these both are different terminology. So I hope everybody understands it.
Yes, doctor. So what are the chances of developing secondary infertility in men, where after having their first child, the infertility is developed at the later age?
Yeah, exactly. So this secondary infertility this is called secondary. The reason is already they have a child, but they are trying for the second child. I've seen a lot of people coming for, they are very anxious for the second problem. Initially, he may be having normal problem. I mean, they were having no problem in the male, but Subsequently, what happens is because of the lifestyle changes. So these lifestyle changes causes like smoking, alcohol, obesity, and then some people, they are in a rapid thing, like they don't want one more child and they get a vasectomy done. And some people, they become obese, the weight increases. Apart from that, some people keep using anabolic steroids. I was telling you, they want to improve their muscle mass and everything. Indirectly, they can cause. And a lot of people nowadays are developing diabetes, hypertension. So diabetes also is one of the reasons why they can have secondary infertility. And a lot of people acquire infections. It could be sexually transmitted or normal urinary tract infections, seminal tract infections. That can lead to, again, secondary infertility. Apart from that, some people might develop varicocele subsequently. Maybe initially he may not be having it. Secondly, he may develop. Apart from this, there are some tuberculosis, that is genital tuberculosis, COX we call, that also can lead to a lot of changes in the seminal tract. It can lead to fibrosis, obstruction, etc. So there is no sperm coming out. That's called azoospermia. So these are all common things which we see for secondary infertility. So it's very important that the health is very important. Lifestyle changes need to be maintained. All these patients.
Okay, doctor. And also research shows the link between obesity and male infertility. You also already mentioned very clearly that being obese is also one of the factors for infertility in men. So, like, doctor, how difficult it becomes for men who are obese to have children? And how does weight affect fertility? And will weight loss help them in improving this condition?
Yeah, definitely. Because obesity itself can directly lead to reduced spermatogenesis. The sperm quantity can go down very fast if the patients are very obese, because there are some hormonal changes which can occur. That leads to excess estrogen, because even in males, we do have estrogens, but the estrogen levels are balanced with the testosterone. But in obese people, the conversion of testosterone is more into the estrogen. That itself can lead to the infertility problem, which indirectly affects the sperm quality, quantity, etc. Even the obesity itself can reduce the size of testes sometimes due to hormonal imbalance and excess heat also, because the fat itself is an insulating mechanism. So that can lead to that. Apart from that, it is also supposed to increase the oxidative stress in the testis, and that can again lead to this thing. And secondary effects of obesity or overweight, they can have diabetes mellitus, hypertension, etc. So these also can again indirectly lead to the sperm quality reduction, DNA fragmentation, etc. So how to prevent it? Yes, the weight loss, yes, has shown a lot of studies have shown that somebody has loses weight by 10 to 20% has reduced the risk of male infertility, and the sperm quantity has gone up by around 20 to 30%. So definitely the good exercise every day, reducing weight, reducing obesity has a lot of positive effect on the infertility aspect.
Yes, doctor. Like you already mentioned, diabetes is also one of the factors for male infertility. Most of the studies have shown that prevalence of male infertility in men with type 1 diabetes was 1.5%. So how does diabetes cause infertility issues in men? And can this diabetic related infertility be reversed in any way?
Definitely. Yeah. Diabetes is supposed to cause it. Type 1 diabetes, as you know, it is insulin dependent diabetes. It is there since childhood. That is because of the absence of islet cell. There is a defect in the pancreas itself, where the insulin is produced, which is the main hormone which is responsible for control of glucose. Unfortunately, children have this problem. And by age of some 8 or 10, they develop even kidney failure. So these patients have a problem because high sugars are there. It causes all the features of diabetic related vasculopathy, neuropathy. That means the blood flow is reduced to the testis and other organs. Similarly, the nervous system is affected. Nerves go down. And these people are prone to get repeated infections. So they can have testicular infections, they can have urine infections, they can have infection of this, the prepuce called melanoposteitis. All these infections can lead to damage to the seminal tract, sperm itself. And diabetes also causes retrograde ejaculation. That means the mechanism of ejaculation is lost. So the sperm goes back into the bladder. So this is also one of the causes. Sometimes they can have ejaculated dysfunction. The sperm, the ejaculate can be low, or it may be zero, absent ejaculate. And apart from this, these patients do develop sexual dysfunction, that is erectile dysfunction. That also can lead to this infertility. So many factors are there, and it itself, the diabetes itself can lower the testosterone levels. So that also can lead to reduced sperm count, at the same time impotence also. So these are some of the factors which can lead to infertility. And probably if you do a pancreatic transplant, most of these people can come back to normal, because it is basically the insulin deficiency. So nowadays, islet transplant or pancreatic transplant has shown benefits in these patients.
Yeah. Yes, doctor. And like you already mentioned about genetic testing. So some of the studies have reported that 10 to 15% of male fertility cases are caused by genetics. So can male infertility be hereditary in most cases? Who should be considering for genetic testing?
Yeah, as you said, it constitutes about 10 to 15% nowadays. And very commonly, to whom we should do this genetic test is very important. Yeah. And first one is patients having severe oligoastenospermia. That means if the sperm counts are less than 5 million per ml, these are the candidates who require to look for the genetic reasons. And apart from that, who are having azoospermia, that means absolutely zero sperm in the semen. These two are the candidates where we have to go for a genetic testing. And apart from this, as I was telling you earlier, the patients already, the history of IVF in the father or mother in the progeny, so they can also maybe having in the future infertility issues. And those having the genetic abnormalities, as I was telling you, CFTR gene, that is a cystic fibrosis gene, these patients also can have some genetic issues. So any history of a family history of these conditions, or patients having severe oligospermia or azoospermia, are the special candidates for genetic testing. And generally, we always test in various types. One is gross chromosomal abnormalities can be tested. That is called karyotyping. Then they can be a genetical problems like genetic mutations, etc. That can be tested by various techniques, by PCR, FISH technique. So many are there. So we go for that. Then we do, as I was telling you, for cystic fibrosis, we do a CFTR gene assay. So that also will tell us if there is any gene mutation in that. And sperm aneuploidy test. There is one test where we can know again, is there any defect sperm which is causing the trouble. So these are some of the genetic tests which we do. And of course, there are other tests, but they are not genetically related. They are non-related to this. So for genetic reasons, he should have a very low sperm, which is less than 5 ml, and azoospermia, where there is no sperm. These are the right candidates to go in for karyotyping. And if there is any such gene, probably we need to see, because this runs in families, it spreads to the offspring also. So we need to counsel them so that they don't have the problem in the progeny.
Yes, doctor.
Yeah.
And also you had initially mentioned that condition of having varicocele is also leads to infertility in men. So studies have shown that many as 41% of males who experience primary infertility have varicocele. So how does this varicocele contribute to male fertility? And does correction of this varicocele improve semen parameters and fertility?
Yeah. Varicocele is one of the treatable surgical conditions in all these male infertile patients. And generally, a bilateral varicocele is very common. That, as I was telling you, grade, that means you can even actually visualize those bag of worms in the testis area. So that is called grade 3 varicocele, which bilateral is affected. Because normally
your voice is breaking, doctor. Hello. Your voice is breaking, doctor. Okay. I think doctor will rejoin again. Till doctor joins, Sutapa, I will just like to ask a few of the diet-related questions to you.
Sure.
So, yeah. So, Sutapa, you all very well know that diet plays a significant role in most of the health conditions. And research has shown that male fertility, specifically sperm count, has been declining for the past few decades. So, Sutapa, can you please explain how male fertility is affected by lifestyle choices and how to boost fertility through diet and exercise?
Yeah, sure. So, as you rightly said, that diet is always connected irrespective of what medical condition we are having. So here also, unlike male infertility, also gets affected with the lifestyle choices that we make. So if we talk about lifestyle changes or lifestyle, it's a very big spectrum. So let's start with our diet, because we eat, and this is a very normal phenomena. So our diet, which is very rich in trans fat, preservatives, processed food, as right generation, like nowadays we're all going out and very opt for packaging food. All these are pretty available. Because we are having huge time crunch on everything. So these are highly preservatives added, which is directly related to male infertility, because it enhances the oxidative reactions in our body. So that's the reason we always promote of having an edible antioxidants, right, rather than not having any kind of an antioxidant therapy or something. Because as a nutritionist, I always promote our edible food, because that are magical one. So antioxidants will definitely help you to get rid of this oxidative stress that I just now spoke. Then exercise. A proper exercise is enhance the oxygen transportation in our body. So that also takes care of the fertility issue. And then coming to the stress. Psychological factor is very much important if we talk about male infertility. Even if we talk about impotency, or even if the person is not impotent or not infertile, still if there are a lot of stress, the person is not okay with, to be anyway, to make any connection with the partner. So that is a very direct relation of stress and infertility. Now coming to the major point, which I will be saying, that the alcohol and smoking. So this alcohol and smoking is a very big red flag towards our this male infertility, that whoever is having very much addicted towards alcohol and smoking, this is very much problematic for the this current condition that we are talking about. So if you are correcting this entire, your diet, your exercise pattern, quitting alcohol and smoking, managing we are learning to manage stress level, then I'm sure we can get a control over this.
Okay. Thanks, Sutapa. Dr. Upendra Kumar has joined back. So, Doctor, we were discussing about varicocele. Yeah. Hello.
Yeah, I would like to tell you that. Yeah.
Yeah.
Are you able to hear me?
Yes, Doctor. Yeah.
Yeah. Actually, the varicoceles cause, because there is a retrograde flow, that is, the blood flow is coming back into the testis. The blood temperature is 2 to 4 degrees more than the testicular temperature, because the testis doesn't bear the warmth. So it is outside the body. That's why 2 to 4 degrees of Celsius temperature is less for the testis to survive. So the sperm is so sensitive. So when the blood is stagnated there, the testis temperature rises. So that leads to sperm reduction in the sperm quality, motility, everything. Apart from this, there is an increased oxidative stress, again, as I was telling you. So that also causes some damage to the sperm, and even the testicular size can go down. And the cause of the other reason why varicocele also leads to infertility is there are some adrenal hormones which are secreted from the left adrenal. So they also act on the testis, and that also leads to reduced sperm concentration. So varicocele is one good condition where once we operate and ligate all those vessels, the
Yeah.
and count also increases, quality increases. So it is very, very important that any person having varicocele needs to be treated at the earliest, so that the pregnancy rates go up very high, very significant, more than the other assisted reproductive techniques. So you better get a varicocele if it is tested, better get it operated at the earliest, and the results start after 3 to 6 months.
Okay, thank you, doctor. And also, it is a very common misconception that the impact of sexually transmitted infections on fertility is a female problem. Is it true that STDs lead to infertility in men, or what measures can be taken to prevent infertility caused by STDs, that is sexually transmitted diseases?
Yeah. Actually, sexually transmitted are very dangerous, because it's not true that women are the reason for that. Even males do have around 50% of males are responsible for that, because all these sexually transmitted, in particular chlamydia, trachomatis, gonorrhea, etc., herpes simplex, these do cause a lot of inflammation of the seminal tract. Even they damage the testes sometimes. So that leads to a lot of fibrosis. So the whole urine tube, the semen tube gets closed. Sometimes there can be some granuloma formation or some pus formation, which leads to defective sperm. This also damages the sperm DNA, etc. So indirectly, all the infections, leave it sexually transmitted or any other things, causes damage to the sexual tract as well as even urinary tract, because some people do develop stricture disease. That means narrowing of the urine tube. Again, it also obstructs the semen. So all these conditions causes sperm blockade, reduction in the sperm size, can damage some of the testes. So all these sexually transmitted diseases are equally important in males, and they need to be tackled early. And second most important thing is prevention is better than cure. So contraception is more important. Preferably barrier methods have to be taken. Otherwise, once you get the changes, it is sometimes very difficult to diagnose, first of all. If you can diagnose immediately, if you give treatment, most of them are reversible. But majority who come to us are at a late presentation. They start getting all the strictures, all the tubes are blocked, sperm count has gone down, there's a lot of pus. So ideal would be prevention. So barrier methods and the contraception is most important for any person having sexually transmitted diseases.
Okay, thank you, doctor. Now, getting back to our dietitian, Sitapa, we often get to know that drumsticks can help men with infertility. Can you please elaborate to our audience how drumsticks or any other foods, especially the vegetables or fruits, that can help to modulate the male hormones?
Yes. So this drumstick, usually drumstick leaves, which is we are often call as moringa leaves. So they are considerable, we call them microgreens. So these are few nutrient they have, like I'll just tell you that some antioxidants are there. So if I mention, it is rich in vitamin E, glutathione, N-acetylcysteine, such things, they are directly related to semen preparation, and they reduces the oxygen species level. That means we call it as oxidative stress. So if we are having a lot of drumsticks, lot of as in, I'm not suggesting only the drumstick thing, but yes, definitely if we incorporate drumstick in our daily diet, so it directly affects the semen preparation or sperm motility, it will be less. So such things will be improved. And nuts, seeds, green leafy vegetables, citrus fruits, like anything which is sour in taste, they are all very rich in antioxidants. And that's the reason they are directly related to sperm quality.
Okay. And also the mineral zinc is proven to be healthy and beneficial for sperm health. So which zinc-rich foods are recommended to enhance the sperm count of men who is usually suffering from low sperm count?
So basically, zinc is, anyway, we know that when this COVID wave was going on, so everybody was after zinc, because zinc is actually it's a very good for our entire immunity system. So if we are providing zinc with folate combinations, so that actually helps the formation of DNA in the sperm. So even the sperm motility, sperm quality, that will be improved with zinc-rich food. So right now, if you can say that which are the best zinc-rich foods, then I will definitely suggest dairy. So it is better if we can go with like low-fat dairy, because there is no point of unnecessarily taking fat thing. So low-fat dairy, eggs, dark chocolate, which is 70% cocoa one, avocado, legumes, beans, these are very rich in zinc. So at least if we can make a combination in our diet that these particular foods we have to include in our lunch, dinner, or breakfast, then definitely such this male infertility or the infertility severity we can control.
Okay. Thank you, Sudapa. So, Dr. Upendra Kumar, as we are coming to the end of the session, I would like to ask you a final question. It's been observed that most of the men usually hesitate to discuss or seek medical help when it comes to issues like male infertility. What would you advise for all those men who are tackling this issue very silently?
Yeah, basically we need to, as you know, all the males have some ego. So they always blame the female. They never say that they are defective. But as you know, around 50% are having male infertility. So what we need to do is we need to educate them, saying that, okay, you need to get generally checked up. Don't say that he is having infertility. So just, it has to be encouraged by the wives. Basically, it is the female who has to take initiative. And they have to, they come to a gynecologist. So at the time of gynecology checkup, the male has to be introduced to the andrologist or urologist. So that is basic semen analysis is done, whether they have children or not, keep it aside. So we need to have one consultation that can be encouraged, either by media can encourage it, or by through gynecologists who can initiate the type of thing. And telling that male that you don't have a problem, but it is always important because it's a combined act. It's not a single person causing the pregnancy. So a sperm can also be a cause for this. So just prevention, it is like ruling out. So maybe having some defective lifestyle changes like cigarette smoking, alcohol, so many things. So it can be, we can actually give them an idea that, okay, if you may get these problems if you continue to use these cigarettes or whatever it is. So we try to give them an education of the fertility issues, how difficult it is once you start getting the problem. So anybody having, in family history, if somebody has difficulty in having kids, it's always safe that they take an opinion initially itself after marriage. So that can be through media as well as through the other doctors or a family physician who is there, who can encourage them to go to the andrologist or the urologist. So that gives a broad idea for the husband also that, okay, we also are responsible equally for this. And suppose there is my problem, which is easily treatable. And it is very easy to test a semen sample rather than testing a female with so many multiple of tests. So once the male is excluded, the female can be taken up slowly. All the tests need to be done. It's a long process. But for a male, giving a semen sample is very simple. So probably that part can be highlighted, telling the husband that, okay, it's a small test, which you can give it in the lab itself, and you get a report, and which gives an idea, okay, you're healthy enough. That ends the matter of the male. Suppose there is a problem, it starts immediately. From day of surgery, day of marriage, we can actually counsel them. Okay, by the time they want to conceive by end of 1 year, whatever small problems can be dealt and the patient becomes normal. So they don't have all these psychological stress, depression, etc. So that is one important thing. Probably all the primary physicians starting from that and other organizations, so NGOs and everybody, they have to educate the people that, okay, there is also a male factor. It is not only the female to blame. So it has to be taken up in a long way.
Yes, doctor. Yeah. Hello. Yeah. Thank you. Thank you very much, doctor. Now I would request Dr. Isha to conduct a Q&A session if there are any audience questions.
Sure, Dr. Jamuna. Thanks, Dr. Upendra. It was quite an insightful session, I would say, and I do believe many of the misconceptions were answered today. I'll just quickly take questions from you. So one of the questions that I'm coming across from one of our attendee is that, does an abnormal semen analysis mean that there will be a birth defect in the child? Because a common misconception around that. Can you just explain?
I know. Actually, one important thing we should know is the semen samples have to be taken, 2 samples have to be taken 3 months apart. And that usually the period is around 3 to 7 days is the abstinence period where the patient has to give semen. And the most important thing is 2 samples, if they show the similar result, yes, then you consider it as abnormal first. Sometimes the sampling itself is error. I have seen some patients having 0 semen. So when we do it, repeat it again, patient collects it properly and it is normal. So it is important that the sperm collection is the most important thing for anyone. So that part has to be excluded. Then if you have a two sperm semen analysis showing defect, yes, these patients can have difficulty in having child, but it doesn't mean they'll have the chromosomal abnormalities or some birth defects. It's very wrong conception, because birth defects rarely occur unless somebody has some lifestyle habits like cigarette smoking, alcohol, etc., some other reasons, or increased paternal age or maternal age. They can lead to some of the birth defects. Otherwise, generally, the birth defects it has no correlation to the semen parameters.
Okay, so that you mean to say that it is as much possible in those who are healthy to those who are taking a treatment. So that
Absolutely.
sums up the answer. Yeah,
exactly.
And doctor, this last question I would say that it's an era of gym. It's an era of building body, right? So
Correct.
And males are into that fad trend of going ahead. So does all this affect the sperm and the fertility? And those who are onto some testosterone supplements for sure for muscle building, can that lead to that issue?
Absolutely. See, normally all these anabolic steroids or any testosterone supplements, normally our body has a routine testosterone which is produced. If you start using an exogenous testosterone, any preparation which has steroids, that actually decreases the endogenous testosterone, which are the normal testosterone levels, and that indirectly affects the hypothalamic axis. That is, it acts on the brain where the hypothalamus is there, which is produced from the pituitary, and it blocks the original FSH, which is very important for our sperm production. Indirectly also the LH is reduced, so testosterone levels in the endogenous one goes down. So indirectly you are harming your tissue because you're bringing out the testosterone which is not really required for you for this building your muscle mass, but indirectly you are causing damage to your testis because the sperm count goes down. And I've seen many patients after using testosterone for a year or two, this testosterone levels are very low. Their sperm counts have gone down to 0 levels also most of the times. So it is very important that nobody uses without any medical prescription, and all the testosterone supplements can also in long term cause cancer of testes or any other parts of the body. So you need to be very careful. It can cause prostatic cancer, etc. So without any medical advice, nobody should use any anabolic steroids or testosterone supplements without medical supervision.
Thank you, doctor. And I do believe that is an eye opener for those who are, into this practice. Thanks a lot for your time. And I do appreciate you taking out all this time and raising the awareness around an issue that doesn't see so much of light nowadays. Thanks a lot. Dr. Jamuna, over to you.
Correct.
Thanks, Dr. Isha, for coordinating. Thank you very much, Dr. Upendra Kumar, for explaining in detail the realities of male infertility and the advanced treatment options that are available for men. So I'm sure that today's audience would have got enough knowledge related to infertility issues and follow lifestyle changes that can optimize their fertility. And also thanks to Sutapa for your valuable inputs on significance of diet to improve male fertility. So dear viewers, to avail the benefits of our care plans and diet plans along with the care coordination services, please download the Qurbook app from Play Store. We have introduced care plans and diet plans for infertility issues in men, which are available in Qurbook app. We will be very happy to serve you and your healthcare needs. Kindly contact us for subscriptions and for any further queries. Thank you all for joining today's session. Thank you, doctor, very much. Take care, all of you. Bye.